Oh, no. Sir, you just vomited. Okay, I'm gonna suction you. Hold on. Oh, shit. I don't have that. Hey, can you get me some suction? Oh, sir, your oxygen's just dropped a little bit. It's just because you vomited. No problem. I'm gonna put you on some oxygen right now. Ah, damn it. I don't have any oxygen in the room. Hey, can you get me some oxygen? Oh, and I need that thing that goes in the wall. Yeah, I don't know where it is either. I looked yesterday or the day before. I just couldn't find it, but I need one. Oh, sir, you need to breathe in and out. Okay, I'm gonna help you. Ah, shit. I don't have that damn thing that you squeeze. Hey, can you give me one of those things, those bags that you put over someone's face and squeeze? And, can you see if you can find me some help too? I need some of that also. Welcome, folks, to the Dim Nurse with me, your host, Blue. Ladies and gentlemen, time is the greatest asset that we all have, so thank you very much for giving me some of yours as we dive into this episode. Folks, just so you know, there's a lot of construction happening today outside here in the city, so there might be a shocking amount of background noise aside from my computer that I'm just not talented enough to filter out for you. So apologies in advance. The only other solution I have is to close my sliding glass doors here. The problem is I live in an unair-conditioned apartment and I will smother and die if I do that here in the middle of May. So, quality issues, perhaps this episode, you should be used to that by now. But in any case, we are the ultimate guide for all nurses, for all things nursing, and quite simply, we tell you things that no one else will, in a way that no one else will, so that you know things that no one else will. And we release these little pearls of wisdom every Tuesday and Friday. And those of you who have held on since the infancy of this podcast, we're still really in infancy, know that this has been plagued with quite a few issues, not least of which was last Friday's acoustic version, or the low rent version, but in any case was an improvement over the week before when the Friday episode was released on a Monday. So we're moving in the right direction, folks. We're improving every time. So just hold on. It can only go up from here. Clearly, I haven't learned to silence my phone or shut my computer up. But it'll be a nice contrast to the pounding outside. Oh, God. So, let's continue what might be another low-rent version of the podcast with a little survey. How many of you will go even a block or two from your home without your cell phone, or without your cell phone and your ear pods, or without your money? I already know the answer. It's none of you. We can barely be within arm's reach of our phone when we're sitting at our houses, much less if we leave our house. It's like a child's safety blanket. And yet, for reasons unclear to me, this is a completely acceptable practice in nursing. There doesn't seem to be a single moment of pause to just crack on with your day without a single piece of relevant equipment anywhere near you or your patient. For example, I get endlessly called to the emergency room for consultation on very critically ill patients. Patients who any person off the street would be able to wonder about their ability to breathe in and out. And yet, I get down to the ER where the patient quite clearly is having a problem breathing in and out, and one of our most basic tools is unavailable, and that is suction. I'm going to just tell you right now that using your hand in an attempt to clear someone's airway of just about anything is a very ineffective strategy. And in an emergency room, not having suction available and set up for immediate use is absolutely outrageous. However, this seems to extend into ICUs, the floors, you name it, plagued with the lack of any useful equipment or preparation. And this leads me into our little chat about preparing for Armageddon. Quite simply, folks, I define Armageddon as the most likely deleterious event that will happen to your patient in the next 12 hours, and something that you should be aware of and prepare for every single day. So, here we go. You come in, you get your report. The very next thing that you should be doing is preparing for Armageddon. That means before you get your coffee, before you go to the bathroom, if you were wise, you've already done this because you just don't know when that's going to happen again. Before you get on Facebook or Tinder or whatever it is, make sure that you prepare for Armageddon. So, you got to do a little dumpster dive. You got to read things that people have been writing about your patient, like your consultants, your primary providing team, the nurses that have cared for this patient before you. Figure out what the main reason for them being in the hospital in the first place is. And from that, have a thought, a pondering, a musing as to what is most likely to happen to your patient that is bad in the next 12 hours and how you're going to prepare and approach that. Quite simply, folks, you need to have extra of whatever tools you're using. That's number one and should be logical. If you are taking someone's blood pressure, you should have a second blood pressure cuff. If you are monitoring someone's telemetry, you should have extra ECG leads. If you're monitoring someone's pulse ox, you should have an extra pulse ox. I'm going to suggest that you have a pulse ox for various parts of the body. And there is no reason on earth that if you were in an ER, an ICU, no matter really where you are, that you should not have an oxygen module, which is that thing that you push into the wall in a port that says oxygen, pushed into the wall with the little Christmas tree that we call it, that green little thing that twists onto the end that allows you to hook up any of the number of oxygen delivery devices. That should be in place. You should have all of your delivery devices for oxygen in your room. So, a nasal cannula, a face mask, simple, and a non-rebreather. Have those. That will get you through 99% of those conundrums. You should have an oxygen. Nope, we already covered that. You should have a suction canister in your room on the wall, as well as a little vacuum port pushed into the port on the wall that says vacuum. You should have the tubing that belongs to the suction, because what in the hell can we do with the suction canister that has no tubing? You cannot will excrement into the container with no tubing. Similarly, if you have tubing, why not have a Yankauer? For those of you new to the business who haven't the foggiest idea what a Yankauer is, shame on whatever nursing school you came from. But it's essentially a curved plastic straw-looking thing that pushes onto the end of your tubing, and it has only one purpose: to suction. That is the whole fucking point. So, please have suction in your rooms, have the ability to actually use the suction, and let's go as far as to say troubleshoot and make sure the oxygen actually works. I can't even tell you how many times we've at least gotten to the point where suction is in the room, but no one has actually troubleshooted it. So, one of the ports is open, so you don't get a seal. The canister lid's open, so you don't get a seal. And the tubing has a crack in it, so you don't get any seal. There's no point if you go as far as to actually having the equipment, all the equipment in your room. I'll admit, that puts you a step above 80% of the other nurses out there, but if it doesn't work, what are you achieving? You have to know if your equipment actually works. So you've got your extras of everything that you're currently using. You have got the supplies that you might need if something goes downhill. And you've had a thought as to what that downhill scenario is going to be, and that's going to dictate any other little pieces of equipment you might need. This is the only way that you should ever start your day. That's it. That's it. That's it. Now, how are you going to decide if Armageddon is befalling you? Hopefully you're paying attention, but this is going to be a little practice that I'm going to want you to adopt into your routine. And something I like to call the rapid assessment, or you can nickname it the Armageddon alert. Every time you go in your patient's room or step near the doorway, you have to look at your patient, look at the monitor, look at your patient, and look back at the monitor. Take note. What color are they? Did you leave them that color the last time you saw them, or are they a new color? If you found a new color, you might want to troubleshoot that. Next, are they breathing in and out? You know this because their chest is moving up and down in what is hopefully a symmetric pattern. If it's not symmetric, or if it's not moving at all, you might want to troubleshoot that. Then, look up at your monitor. What is your heart rate doing? And what is your rhythm doing? Is it exactly the same as what you left it? Or is it now something different? Different as in faster or slower? Might want to troubleshoot why that is. What is your blood pressure doing? Is it high, low, or normal? High and low may suit your patient depending on what's wrong with them. So if you know what's wrong with them, you'll know if that's good, bad, or indifferent. And if it is bad, you should be troubleshooting why that is. Now, if you're real fancy and you have an arterial line, this should be your next point of contention. What is your waveform doing? At this juncture, we care about only two versions of your waveform, and that is jagged or flat. We're going to leave it there for now. Flat means your patient is either dead, they have an arterial line that's very positional, or an arterial line that has parted company with your patient's body. You might want to troubleshoot that. If you don't have an arterial line, I'm going to tell you to, before you glance up at the monitor, to do a novel thing and feel for your patient's pulse and see if they have one and what kind of quality of pulse do you have. Can you barely feel it? Can you feel it so much that you feel like you're being assaulted by it? Or somewhere in the middle? And depending on what's wrong with your patient, you might want to troubleshoot that. Back to your monitor. You want to take a gander at that pulse ox since you took the trouble of attaching the sticker to their finger. If they have a respiratory problem and you didn't attach the pulse ox to their finger, you need to leave the business right now. Because what are you doing? Honestly. You need to see, number one, how the waveform looks. And if you're new to the business and haven't the foggiest idea what a good waveform is, shame on whatever nursing school you came from. And go look it up because it's really hard to explain on a podcast. It's something like a rounded, jagged pattern or a rounded version of your arterial line. If it's good, then we care about what the number says. If it's bad, the number is useless. So, let's assume it's good. Then what's your number? Good or bad? And if it's bad, you might want to troubleshoot that. Every single time you go into your patient's room, it should be, look at the patient. Look up at your monitor, look at your patient, and look back at the monitor. This whole process takes about 60 seconds, so you have no excuse. Make sure that those three simple things that keep most people trugging along, which is your ability to have an airway, your ability to breathe in and out, and your ability to move blood around the body, or your A, a B, a C's, are preserved. Then you can carry on with the more important tasks of the day, which is coffee and Twitter and Facebook and Tinder and Hinge and Bumble, whatever you want. I mean, at some point and maybe periodically, you might want to do a real assessment of your patient, but that's a topic for a different day, so who cares? Folks, anytime a code scenario happens, an emergency happens, a so-called rapid response happens, 99% of the world is unprepared. It's all pandemonium. It's plagued with poor leadership. So the only way that you can hope to have a modicum of calm and efficiency throughout this drama is if you put a little thought into preparing for what Armageddon might be, have the tools that you need to ward Armageddon off with, and make a conscious, determined, and deliberate effort to assess for Armageddon at every possible patient interaction. Again, this separates our contenders from the pretenders, which is, of course, the whole point of our podcast. All right, ladies and gentlemen, I'm going away now. Thanks very much for listening. You've been a very, as ever, attentive audience to work with. Take care. And if you're going to work or you're going to school, whatever it is you're doing, hopefully you're a little less dim.